Today we're going to be talking about ethical considerations in nursing research. Any nurse researcher who is working with human subjects has to abide by certain ethical considerations when planning and executing the research. We're going to talk about what those are and how nurses who are doing research can solve ethical dilemmas. We're going to start this conversation about ethics by looking at ethical codes. Ethical codes were developed in response to some of the atrocities that occurred during World War II, where Nazi physicians were unauthorized working on prisoners of concentration camps and doing medical procedures that the prisoners had no control over and not any voluntary participation. So the first code of ethic we're going to talk about is the Nuremberg Code, which was established in 1947, right after the Nuremberg trials ended. It became apparent that it was necessary to have some control over the types of research that could be done with human participants. So the Nuremberg Code addresses voluntary participation in research, protecting subjects from harm, the right to withdraw, and the affirmation of the researcher's credentials. And this was really one of the very first codes of ethics that became publicized and under which most, and if not all, medical and nursing research has to abide by. Many years later, in 1964, the World Medical Association decided to look at expanding the concepts in the Nuremberg Code to looking at how medical research with human subjects would be conducted. So the Declaration of Helsinki in 1964 is directed specifically toward medical research. First of all, it affirms the principles of the Nuremberg Code, which, if you remember, address voluntary participation, investigators' credentials, etc. So Declaration of Helsinki affirms the principles of the Nuremberg Code and adds a few other aspects. First of all, it categorizes research into two major categories: research that provides direct value to the subjects who are participating, or research that provides no therapeutic value. And you might wonder why medicine or nursing would be involved with research that provides no therapeutic value. But if you think about investigational drugs, for example, someone who has terminal cancer, who has received all of the standard treatments, may agree to participate in a medication trial, knowing that that particular medication may not have any effect on their own illness, but might provide some information so that others in the future might be able to receive therapeutic value from the medication. The next piece of the Declaration of Helsinki is recommendation of written consent. Prior to that, there was no mandate that participants of research would have to actually write down their consent. Verbal consent was accepted, and the Declaration of Helsinki recommended that instead of verbal consent, written consent would be absolutely necessary before any type of research could be conducted on human subjects. And third, the legal guardians are allowed to grant permission for subject participation. Legal guardianship most often is concerned with vulnerable populations. And when we consider vulnerable populations, first of all, we consider children as under the age of 18 as a vulnerable population. Other vulnerable populations include those who are mentally ill or cognitively incompetent to make decisions, prisoners, pregnant women, and occasionally there are other types of human subjects that are classified as vulnerable populations. And in these cases, a legal guardian may be appointed by the court, or there may be legal guardianship already established, and legal guardians would be allowed to grant permission for human subjects to participate in particular research, even though they may be part of a vulnerable population. More recently, the American Nurses Association, which is our professional organization, developed guidelines also that address ethical issues involved with our practice, as well as ethical issues involved with nursing research. And this is published in the form of an ethical code. If you go to the American Nurses Association website, you can see what that ethical code is. It's in a PDF format, and you can actually access it from the website. The ANA has declared 2015 the year of ethical considerations, and so there's a lot of material on the ANA website about ethics. In the ANA guidelines for research, the ANA affirms the rights of individuals to privacy and dignity, and to freedom from injury. In doing so, it considers the following. It considers the risk-benefit ratio of any type of research. In other words, the nurse must consider whether the benefits will outweigh the risks of the nursing research that's being proposed. It also considers anonymity and confidentiality. Confidentiality is when the researcher actually knows who is participating in the research and has identifying information about that person. Confidentiality must be established, and the participants must be reassured that confidentiality will be maintained. And there are procedures for maintaining confidentiality. For example, separating any information that could identify a participant from the actual results of, say, an interview. Anonymity is something else. Anonymity is when the researcher does not know who is participating in the research, and therefore there's no identifying information at all that's submitted. Freedom from coercion and deception. Coercion is when a reward or an incentive is given to participants to participate in a research study, and that reward or incentive far exceeds what would be the normal standard for for gaining participation in a research study. We'll talk about coercion and deception a little bit more a little later. And voluntary participation, this is one of the precepts of both the Nuremberg Code and the Declaration of Helsinki. The ANA guidelines also looks at informed consent and says that any nurse who is proposing any type of a research project must demonstrate that the participants have been clearly informed about what the research is about and what their responsibilities are relative to the research. And again, we'll talk about informed consent a little bit later. And then finally, institutional review board. Institutional review boards are subcommittees of agencies that will review proposals for nursing research or medical research that involves human participation. And the Institutional Review Board really does an in-depth study to be sure that there are minimal risks to those who choose to participate in the research. So ethical codes that we've talked about before are actually a compilation of ethical principles. And all codes of ethics are related to underlying ethical principles, particularly these three. The first one is beneficence. And I know this is kind of a hard word to pronounce, but it comes from the Latin bene, which means good. So in other words, the principle of beneficence is focused on doing good and avoiding harm. The next ethical principle that is included in most of the ethical codes is respect for human dignity. And the third one is justice. The principle of beneficence is, as I said earlier, focused on doing good and avoiding harm. So what it does is it ensures freedom from physical and psychological harm. And the focus of the research must be on the fact that the benefit of the research will outweigh any risks that are associated with the research. So any study that poses a danger has to be terminated. An example of this is several years ago, there was an investigational drug for multiple sclerosis, and it was in a stage 3 drug trial, and it was found to be very, very effective, so effective that patients with multiple sclerosis were demanding that the FDA release the drug to the general public. So that was done. And what ended up happening was, after the drug was released to the general public, there were reported several cases of deaths related to inflammation in the brain. So the FDA immediately halted the sale of the drug until the drug could be investigated a little bit more thoroughly. It has made it back onto the market, but it's just an example of how the FDA or any other organization is responsible for terminating a trial of a drug when it knows that there is some kind of danger associated with it. Principle of beneficence also provides for debriefing and referral in cases of psychological discomfort or harm. There are some types of research that involve direct face-to-face interviews, and maybe interviews about sensitive subjects that might actually trigger emotional responses in the people who are participating in the research. In that case, the nurse or the physician, whoever is conducting the research, will talk to the person or the participant after the interview is over to try to, what they call debrief, try to encourage the participants to express feelings so that the nurse can assess whether a referral is necessary. And if a referral is necessary, the referral must be made to a psychologist or a social worker or someone who could help that participant deal with any of the emotional issues that arise as a result of the research. The principle of beneficence also ensures freedom from exploitation. And what this means is that information given during the course of the research cannot be used against the participant. So, for example, if a nurse researcher were conducting an interview with adolescents, regardless of the goal of the research, and doing the research, one of the adolescents tells the researcher that she or he is using an illegal drug. Because of confidentiality, the researcher can encourage the participant to seek treatment, but cannot disclose that information to others. A major exception to that would be if the researcher were doing research, especially on adolescents, and there was a chance that an adolescent might disclose feelings of committing suicide or intentions of committing suicide. The researcher needs to tell the adolescent or the participant in advance that if any information such as a plan to harm oneself or others is conveyed during the interview, that the nurse would be obligated to notify others of that information. Mainly because it's protecting both the participant and others if others are at risk. Freedom from exploitation also provides for an explicit agreement about the scope of the study. In other words, the nurse must sit down with the participant and explain the exact course of the research, what is included, what is not included, and the participant must agree to participate in the research through informed consent, which we're going to talk about a little bit later. And finally, nurses cannot exploit their position to gain information that would not otherwise have been forthcoming. So, for example, if a nurse is doing research on a particular patient unit, and then she interviews patients or he interviews patients during the course of the research, and then is responsible for caring for patients later, information provided within the care situation cannot be used as supplemental information to the research, because that would be exploiting the care position to favor the research position. And finally, probably the most well-known or the most important part of the principle of beneficence is considering the risk-benefit ratio of all research that involves human participants. So the researcher needs to think about, do the benefits to individuals or humanity outweigh the risks that might attend the nursing research project itself? Second thing is, does the benefit gained from the research outweigh the costs? For example, it could be nursing research, or any other research for that matter, can be very, very expensive, and it depends on what the research is. And the research should show a benefit that would justify spending the amount of money that it costs to conduct the research. So, for example, a colleague of mine, I think I have spoken about this in class, a colleague of mine wanted to look at whether a PET scan could predict which postpartum women would be at risk for postpartum depression. Well, obviously, a PET scan is extremely expensive, and there are other ways of assessing risk for postpartum depression. So in that case, the cost would outweigh the benefit, and it would not be worth the cost to do that type of research. And considering the risk-benefit ratio also guards against superfluous research, meaning that that's research that really has no value to the medical or the nursing profession. And so considering risk-benefit ratio is important because it can bring to light the fact that the research is not going to make enough of an impact on the results. So it probably would not be appropriate to conduct that type of a research study. The second important ethical principle that nurse researchers must consider is the respect for human dignity. And this includes two major aspects. The first one is the right to self-determination. This is the aspect of research that addresses voluntary participation. Participants must agree to voluntarily participate in the research. They cannot be coerced in any way. And also, they must be told that they can withdraw from the research at any point in time without any kind of penalty. And secondly, the incentive reward for participation in research is not excessive. Excessive incentive is called coercion. So often you may hear on the radio of a medical center recruiting people to participate in some sort of medication trial or a diet program or some other type of research. It's often stated in the public service announcement that the participants would be reimbursed for normal food and travel expenses plus a small stipend. This is not considered to be coercion. On the other hand, if a nurse researcher were researching a homeless population and decided to recruit homeless people by going out, say, to Boston Public Gardens or Boston Common, looking for people who would participate in the research, and then offering them $1,000 to participate in the research, that is coercion. Obviously, a homeless person could not turn down a $1,000 incentive and would feel obligated to participate in the research. And that is called coercion. Oftentimes, researchers will provide a small incentive to increase participation in the research. For example, mailed surveys. Oftentimes, people might receive a mailed survey where a researcher is trying to obtain information through survey, and included in the survey might be $1 or $5 or some kind of small monetary incentive for the person to encourage them to participate and answer the questions on the survey. Of course, what happens then is the researcher takes the risk that the person will keep the money and not participate in the survey, but that is a risk that researchers are willing to take. Usually it's a very, very small amount of money, and oftentimes it will encourage people to fill out the survey and return it as the researcher would want. Second aspect of the principle of respect for human dignity is the right to full disclosure. And the right to full disclosure essentially means that the researcher must describe in detail the nature of the research, what the participant responsibilities are, and what the researcher responsibilities are regarding the research, and also the risks and benefits that may be or may not be associated with the research itself. It is with this requirement of full disclosure where the internal review board actually supervises any type of research project to ensure that there is full disclosure for the participants. So an internal review board, sometimes called an institutional review board and often referred to as an IRB, is a selected agency committee that reviews all proposed research activity that will be conducted in that particular agency, a hospital, an educational institution, or whatever. Depending on the type of research that is proposed, the researcher can request what's called an expedited process. In an expedited process, usually the research is not very complicated. It would use human subjects, but it would not be using people who are from vulnerable populations. Oftentimes it's just survey research, which is anonymous return, and therefore no identification of the participants is involved. And what the researcher would do would be to apply to the IRB for what's an expedited process. In that case, the IRB would look at the parameters of the research and make a decision as to whether they needed more information or they felt that the risks were high enough that they wanted to do an intensive or a full review. If it's decided by the IRB that the research is subject to an expedited process, what will happen is the researcher will receive a letter from the IRB stating that it is all right to proceed with the research under the expedited process decision-making of the IRB. The second type of IRB review is a full review or an intensive review. I have posted on Facebook a copy of the Curry College IRB application for research. So if you would take it out and look at it, we're going to discuss it in a little bit of detail in the upcoming slides. Looking at the Curry College IRB full proposal review, you'll notice that almost everything that we have talked about previously is actually on this application form. So first of all, researcher information. Remember that the ethical codes affirm that the researcher's credentials must be substantiated on every research project. So the researcher information would include the name, phone number, email, maybe the department for which the research is being done. Occasionally students will participate in research or conduct research projects with their faculty member, and in that case the research advisor will need to provide information as well. Project information is important, the project title, the purpose of the study, in other words, what are the research questions that are going to be answered through the research. We'll talk about research questions in a couple of weeks. What kind of research methods will be used? How will the data be collected? How will the data be analyzed? And then any benefits, if there are any, to the participants and or to the discipline or profession. Then we go into who participates in the study, and this is called the sample, and the researcher must describe who gets to participate. How many will there be? What kind of characteristics are necessary to be included in the study or excluded from the study, and also a description of any risks or hazards or inconveniences that might happen to the research participants as a result of participating in the study, and what the researcher plans to do to minimize those risks. Then the application talks about vulnerable populations. It's necessary if the nurse researcher is conducting research on a vulnerable population, that population has to be described and who gets to give consent or assent to the research. So vulnerable populations include, as I said earlier, minors, those children under the age of 18, prisoners, those not able to provide consent due to limited ability to understand the research or to understand the risks and the benefits, and then other vulnerable populations. For example, if a researcher is doing research on patients who are about to enter surgery for a surgical procedure, and the researcher is very interested in emotional feelings and so on, the researcher could ask that person for willingness to participate in the research. The only problem is if that person has been medicated, the person may not be able to cognitively understand the scope of the research, and therefore that person would be considered a member of a vulnerable population and may need to have a family member or someone else make that decision for him or her. What type of information does the researcher collect from the subjects, and how is that collected? The information may be private, it may be sensitive, and as I said earlier, sometimes researchers will require information that is psychologically capable of causing some emotional distress to the participants. Then the next step is looking at confidentiality, which we talked about earlier. What methods is the researcher going to use to ensure that confidentiality is maintained? So this might involve using pseudonyms or false names when reporting the results of the study. It might involve just coding people by number. It probably will involve keeping identification information completely separate from responses to research interviews. Let's see. The subjects may be compensated, as we talked about earlier. So normally it would be a small gift card, raffle, a small amount of money. In the case of students who are conducting research, it may involve extra credit as an incentive. And that has to be described in detail to ensure that there's no coercion involved. Next, does the research involve any type of deception? Deception essentially means that the researcher is not conveying the exact purpose of the research to those who are participating. And this is allowable under certain circumstances. For example, say you were doing a research study on hand hygiene in your hospital or your agency. You would not want the nurses who are participating to know that you were specifically looking at hand hygiene, because you and I know what would happen in that case. The nurses would all practice very, very good hand hygiene, and that would bias the results of the study. So you as a researcher could tell the participants that you are looking at their everyday, day-to-day activities relative to how they approach patient care. And of course, hand hygiene is part of that. So that would make it less likely that the participants would be focusing in on a particular aspect of patient care, and therefore would decrease bias into the research study. The researcher also has to be protected, and so the researcher has to address whether there's any kind of risk or hazard that might occur during the study that would affect adversely the researcher who is conducting the study. And again, how would those potential risks be modified or minimized? And then the IRB will ask for a copy of any and all of questionnaires or surveys or protocols or whatever associated with the project, and also informed consent. Now, we haven't talked in detail about informed consent, But essentially, informed consent fulfills the obligation, the ethical obligation, that the patient be fully disclosed of all of the aspects of the research. So, in an informed consent form, which, if you remember, is written, it includes the following requirements. First of all, the researcher must state in the form that the study involves research so that the participants know that they are actually being researched. The purpose of the research should be stated, and the expected duration of the research project. So, for example, if you are doing an interview, the interview might last an hour so that the participant knows that participating in the research will require an hour of his or her time. Or in the case of a survey, it might just require 10 minutes. So the researcher has to state up front approximately how long the participant will be required to be involved with the research. Then the specific procedures of the research need to be described, along with any possible or potential risks or benefits to the participants. In a lot of nursing research, there are very, very few risks and very few benefits, although nursing research is designed to maybe not benefit individuals as much as benefiting the population of individuals. So all of that must be explained right up front in the informed consent. There should be alternative procedures described. So, for example, if a nurse researcher was doing intervention research, such as a new type of procedure that is going to be compared to the standard of care, the nurse researcher must explain the difference between the new procedure and what the standard of care is. That way the participants are fully informed and can make an informed decision as to whether or not they are willing to participate in the new research, or if they would just prefer the regular standard of care. Then the researcher must supply the participants with all of the information as to how the researcher can be contacted. And then finally, there must be an absolutely written firm statement to the researcher in the consent form that says that the participant has the right to withdraw from the research at any time without any type of penalty. So anytime a nurse does research, the nurse has to address consent. So what happens when it's anonymous research? How does the nurse do that? Well, what happens is when the research is anonymous, such as an online survey or a mailed survey, what the researcher must do is essentially write a cover letter. And in the cover letter, the nurse will address everything that the consent form requires. So all of the items that I have just discussed would be included in the cover letter, including the statement that the that the participants can withdraw from the research. So in an anonymous survey, obviously the participant is not signing a consent form. So what happens is, if the participant chooses to participate in the research and send the survey back to the researcher, then that is considered to be implied consent. In other words, the researcher has given full disclosure of what the research is about and so on, how long it's going to take. And should the participant choose to complete the survey research and send it back, that means that that participant has, in essence, consented to participate in the research. There are some consent problems that the researcher has to consider when planning out the research. The first one is considering who gets to consent for anyone who is a member of a vulnerable population. With children, obviously the family member or parent is the one that will sign a consent for a child to participate in the research. However, in children older than 7 years, the researcher should obtain that child's assent to participate in the research. That doesn't mean that a parent cannot consent for research that is going to provide value to the child, even though the child decides that he or she does not want to participate in the research. But it is common practice to obtain the cooperation of a child when children are being participants in a research project. Research bias is also a problem, and research bias occurs when the researcher is looking for volunteers to participate in the research. So if you're going to the mall, for example, and someone is standing there with a clipboard and as you walk by, asks you to participate in a research or survey that they're doing about something that has to do with the mall, it will only take 10 minutes, they tell you. You have a decision. You can, if you're interested in the research, you can sit down for the 10 minutes and complete the survey and do the research. If you're not interested, like I am most of the time, you just walk right by. So then the researcher has to consider, is there any difference between the people that choose to participate in the research and the people that choose not to participate in the research? And this comes up every time a researcher would use volunteers to participate in a research project. And the problem with this situation is that using volunteers can introduce research bias into a study because of the fact that there's no way of determining whether the people who participate are in fact different from the people who do not participate. We talked about using concealment or lack of full disclosure, and you can only use deception, which is what we talked about in terms of a study that might involve hand hygiene, where if the participants know what the researcher is looking for, they will change their actions accordingly. So you can only use concealment if there is minimal risk. In an ethnographic study, which is when the researcher is essentially researching cultural aspects of certain populations or ethnic aspects or ethnic traditions in certain populations. In that case, ethnographic research sometimes will require that the researcher not reveal the entire or full scope of the research. So the IRB will have to make a determination if concealment is appropriate, and they will only do that if there is minimal risk to the participants. The last ethical principle to be discussed is the principle of justice. And this principle covers situations that look at fair treatment and fair participation for all of the participants that have agreed to participate in the research. It also addresses right to privacy, so confidentiality and anonymity, which we discussed earlier. So the nurse researcher needs to look at how the participants or the sample is going to be selected. And that addresses inclusion criteria and exclusion criteria, in other words, those that will be included because of certain characteristics and those who will be excluded because of certain characteristics. And the researcher has to ensure that the selection of that sample is not discriminatory. In other words, that people are excluded because of some external factor, could be income, could be ethnicity, could be any number of various demographic factors that actually would bias the research if those people were not included rather than excluded. So the selection cannot be discriminatory. The researcher has to honor all agreements, and that goes to the informed consent. The researcher must abide by anything that was reported in the informed consent that the participants signed in order to participate in the research. If the researcher has to adjust any of that, then the participant has to be informed again and agree again to participate in the research. The researcher has to be sensitive to culture and values of others. The researcher has to be accessible meaning that the researcher gives contact information and the procedure for contacting the researcher if there is an issue. And again, the researcher must provide follow-up assistance to anyone who is experiencing any kind of distress as a result of the research. In nursing practice or nursing research, we often encounter ethical dilemmas. An ethical dilemma is a situation that occurs when there are ethical conflicts or conflicts among ethical principles. So one example is the risk versus benefit. In other words, when we think about beneficence, we think about doing good and avoiding harm. But there are some situations where the approach to avoiding harm actually causes harm. So an example is if a patient is at high risk for a fall and the goal is to have fall prevention, the outcome, of course, is good to prevent falls. In an adverse outcome, the patient would fall. So the decision has to be made as to how or what the best approach would be to prevent falls. If the patient falls all the time, the approach might be different than if a patient just had a single fall in a hospital setting. So occasionally, it is required to use either physical or chemical restraints to prevent a patient from injuring him or herself through a fall. The use of physical or chemical restraints is certainly not encouraged and isn't beneficial particularly and could have the potential for doing harm, but the fall might have potential for doing even greater harm. Decisions that are generally accepted based on accepted moral principles. So this also can cause an ethical dilemma. An example of this is, for example, telling the truth versus withholding the truth. So you have a patient who is newly diagnosed with cancer, and the physician talks to the family, and the family tells the physician that they do not want the patient to know what the diagnosis is. So it puts the nurse or the physician in a position where they may have to be withholding the truth at the family's request, while really believing that the patient needs to know the information. So that is a real ethical dilemma. And then also part of an ethical conflict would be, for example, decisions based on the greatest good for the whole. So when you are a nurse and your agency requires you to have flu vaccine, your agency is looking out for the good of all of the patients. You might be looking out for your own good in terms of whether or not you feel the flu vaccine will benefit you more than your ability to care for patients. So that's why hospitals have mandatory vaccine programs that takes the decision or the ethical dilemma away from the nurse, essentially, where hospitals are now mandating nurses to either be vaccinated against flu vaccine or wear protective equipment in order to prevent the transmission of the flu virus. Ethical dilemmas can occur when one considers whether individual rights are more important than the rights of the population as a whole. If one believes that everyone is entitled to equal rights and treatment, and that all are entitled to equal access to goods and services, it requires that the government, who is in charge of allocating goods and services, participate in distributive justice in a way that goods and services are allocated such that everyone has equal access. This tends to be a little bit more of a problem when medical treatment, for example, is extremely expensive. So when medical treatment is prohibitively expensive and people are are receiving their health care through government financing, those with Medicaid, for example, which is a program by the government that assists poor people to access medical treatment, Medicaid may not permit costly treatments for an individual because a costly treatment for an individual decreases the available of financing for the whole population of Medicaid patients. An example of this is that recently a child in my area needed an experimental treatment that was only available, it was a treatment for cancer, that was only available in Seattle. The child was a Medicare patient, and the family applied to Medicare to cover the cost for the child to go to Seattle, to stay in Seattle, and to receive the experimental treatment to save his life. Now, if you were a parent, obviously you would be much, much more concerned about your own individual child. The government, however, the state government in this case, has to be concerned about the whole and concerned about the entire population of Medicaid. So the Medicaid denied the parents' request to have the child participate in this experimental treatment. And there was a lot of anger and a lot of discussion about this issue. And finally, the child was given permission to go to Seattle. The treatment was prohibitively expensive, but MassHealth agreed to pay for it in the end. And unfortunately, the child did not survive. So depending on how your beliefs are as to whether the individual rights, even though they may be especially expensive, can trump the collective rights, is an ethical dilemma. The other part to that individual versus collective rights is that a belief that the right to private property is much more important than common property. And if you believe that, then you believe that the government should essentially limit its intervention. So, for example, in the Ebola epidemic, the public health regulation essentially stated that if you had been in certain countries in Africa that had Ebola and returned to the United States, that you would have to be confined or quarantined for a certain amount of time to be sure that you did not develop signs and symptoms of Ebola. And that was very problematic for some of the people who believed that their individual rights were more important and that they were not symptomatic. The exposure wasn't actually a direct exposure, and therefore they should not be confined to their home. So once again, it's that ethical dilemma whether or not the individual right is more important than the right of the population as a whole. So before I get into a discussion about how we approach an ethical dilemma, what I'd like you to do is to think about an ethical dilemma that you might have encountered in your workplace or think you might someday encounter it in your workplace. Please email me naming the ethical dilemma and the circumstances. This does not have to be long. Just a sentence is perfectly fine. I just want you to start thinking about an ethical dilemmas that you might encounter in your practice. And we are going to go through some of the steps that you need to consider when trying to solve the ethical dilemma. So if you would email me that, I would appreciate it. Now, how do we approach an ethical dilemma when we encounter it, either in our nursing practice or in nursing research? First of all, the first step is identify the ethical issue. What actually is the issue? Describe what that is. And then consider what ethical principles might be in conflict, in particular, ethical principles that might be in conflict in this issue. Then you want to look at the context. What are the contributing factors to the ethical dilemma? What are the important contextual factors? And describe those. So you want to think about all of the relevant data in the particular situation and write it all down so that you can look at it and try to analyze it. The next step is to think about whether there is a way to look at the dilemma differently. Is there another way of approaching the situation? So you want to consider possible different approaches to solving the dilemma, keeping the ethical principles and the cultural differences in mind so that you don't go from one ethical dilemma to another ethical dilemma. Once you have gone through those steps, then you can make recommendations as to how to approach the dilemma. Now, why is this all so important, this discussion about ethics? And what use does it have for you as you are looking at nursing research studies? Well, any nursing research study, somewhere in the study, will have a statement about the ethical considerations in the study. And when you look at the agree format that we're going to go into in a little bit more depth in the future, one of the items on the agree format asks you to consider whether the nurse researcher followed the ethical considerations when planning the study. So the nurse researcher and you need to consider, was the benefit of the risk ratio acceptable? And did the nurse researcher describe what those benefits or risks are in relation to the specific study? Were there any anticipated adverse effects that the nurse researcher identified? And were these reasonable risks to take in light of the benefit derived from the research? Were there any ethical dilemmas involved? Did you think that there were any ethical dilemmas? And do you think that the nurse researcher appropriately solved the ethical dilemma for the purposes of the research? Very important that somewhere in the nursing research article, the nurse researcher states that the study was approved by the appropriate internal review board. Also, very important to address in a nursing research article was whether informed consent was obtained, and were competency issues considered in obtaining the consent for participation in the research. This all should be described in the article that reports the research. So you need to be looking for that statement. If these are not in the article and they're not addressed in the research, then that's considered to be a weakness of the study because rigor is not considered. Now, there are some studies, obviously, that don't use human participants, and so therefore the study doesn't need to be approved by the appropriate IRB. But any study that is actually using humans as participants in research, there must be a statement that the informed consent was addressed and the study was approved by the appropriate IRB. Then as you read through the nursing research report, you need to think about, were the subject's rights protected throughout and were appropriate regulations followed throughout the research? So you're going to be looking at this particular section of any nursing research article that you choose for your final EBP topic.